Thank you for joining us on Black Chronicles. This is Dara Mendez, Health Equity Editor for Black Chronicles, and today we speak with Dr. Yinka Aganga-Williams and Alysia Davis, leaders of the organization AJAPO, Acculturation for Justice, Access, and Peace Outreach, an organization focused on providing support to refugees and immigrants in the greater Pittsburgh region and Allegheny County. We will discuss their ongoing work and critical ways in which they are supporting refugee and immigrant communities during this global pandemic. We have Dr. Yinka Aganga-Williams, originally from Nigeria and co-founder for AJAPO, and has been executive director for close to 14 years. And we're also joined by Alysia Davis. She's the secretary of the board of directors for AJAPO, also a trained birth doula, certified lactation counselor or consultant, and is currently working for the Allegheny County Health Department. Thank you both for joining me.
Thank you.
Thank you.
So first, if you can share with us just a little bit about the history and mission of AJAPO and some of the key areas of focus.
We started off in 2001 with the support given to the resettlement of the then Sudanese young men who came to Pittsburgh and were resettled officially by Catholic Charities. And we found out that it takes a whole lot more to do resettlement than what a church can provide, because we were then working through the Catholic Church St. Benedict the More in the Hill District. And in 2004, we got our own nonprofit award through the IRS. And basically that initial focus remained, which is why we are called the acronym AJAPO, meaning linkage of people who are coming in from Africa to their African-American brothers in the Pittsburgh region. Our job practically focuses on resettlement as of today, resettlement, employment, youth development, immigration services, and we strongly believe in family, so we have a program that is also family cohesion and empowerment. So these are the areas in which we operate.
Great, thank you. And I know you serve close to 300 individuals or families each year. So can you share a little bit about the ways in which AJAPO has been supporting families during this time, and if there's been any major shifts in your work as a result of COVID-19?
Okay, just to add to that, we actually serve, even before COVID, about 410 individuals, representing roughly about 120 families within Allegheny County and the Pittsburgh region. Employment, it takes a lot to be able to find jobs in a land that is new, where you don't even speak the language and all that. So if people went through their 3 months of resettlement, which is what the government gives the refugees, 3 months you resettle and come on, find a job and start paying your taxes. So we do take them through that and train them in employment, acculturate them. That is a very, very big part of our job. Acculturation in the 90 days, a continuous acculturation for everything else that they need to know. Get them a job. We have well over 30 employers through whom we work. Place them on the job, be able to follow through both with the employers and they themselves, which many employers really appreciate, because then we do help them retain the job. And this is how people take care of their families, because originally when they come, yes, they're enrolled in welfare, but the moment they start working, welfare cuts off all that benefits and they have to take care of their families. The resettlement is finding them housing, enrolling their kids in school, ensuring that we connect them to the community, get them to be health screened in case there are any diseases or any illness they need to, so that way we are sure that all of us are good, both Americans and themselves. But beyond that is for the continuous purpose of their health, if anything was happening, their health insurance and all that. We do have a specific department, which is that family cohesion department that does the school enrollment and does all the follow-up. So it's really a big thing and a big challenge for them this particular time, for that department to follow up with all the school and be able to ensure that kids are getting the resources they need to be able to continue with their education. So back and forth with school. Student A didn't get their laptops. Student B already got their laptops. How do they kind of get things going? When is their assignment coming in? Those are all the added job that we have had to do. And then, of course, because many of our clients are wage earners, they were all laid off. So we've been doing a lot of completion of employment application, completion of welfare application, explaining to each and every one of them how things are going to work, apart from the COVID information that we have had to send right from the beginning of March. And we have also developed like a COVID video that is appropriate to the situation, sharing that via Zoom, via videos, via FaceTime with our clients. But the added part is the fact that even when we have those, we are unable to share except we have interpreters. So again, it becomes three ways to be able to communicate. So communication is kind of paramount in all this.
Mm-hmm. Thank you.
And I was gonna say, if I could add a piece, in the beginning when Dr. Aganga-Williams talked about our mission and the importance of acculturation, one of the things that I think makes AJAPO so unique in comparison to other immigrant and refugee resettlement services and agencies is that while our focus is acculturation and helping new folks understand what it's like to live in this country and helping them navigate our systems, we do it in a way that still values the culture and their cultural practices and ideologies that they had from their native land. And so it's really important to hold those two as truth, because what we don't want to see is people coming to this country and not keeping their native language, not cooking their ethnic foods, not practicing their cultural traditions. And so how to help people be in this new society, understand our laws and our policies, but then also how to keep that family cohesion and that integration of your culture and this new culture, how to balance the two and keep those strong bonds. And so that's something I think not all organizations do, and that's something that we do really, really well.
Thank you for that.
And that is important to the American society. Mm-hmm. That this is part of your enrichment. It doesn't take away from America.
Right, right, absolutely. Thank you for that. You shared quite a bit about sort of these intersections. And one that comes to light would be some of the core legal or policy issues that your organization has been leading, involved in, but perhaps have escalated or may have made some shifts in the context of COVID. So could you talk a little bit about that as well?
In terms of legal issues, I would not say as a nonprofit, we do not have the permission to kind of be part of any of those, especially when it has to do with the government as our funders. However, nothing stops us from advocating. We cannot lobby, but we can advocate. And a good part of the advocacy work that we have done has to do with the numbers that are being permitted to come in the past, and at a stage when the governors and the chief executive of the county and mayors were being required or requested to indicate formally if they would resettle refugees in the future. I think we were very, very much on the lead with that, especially as far as Allegheny County and Pittsburgh is concerned. So we were involved in that advocacy, being able to go to our elected officials and indicate what the situation is and work with them and see how can they really be in the forefront. And for Pennsylvania generally, we have a great governor who supported that. So our elected officials locally, both the chief executive for the county and the mayor, strongly supported that. And I believe we were one of the first that kind of sent letters of consent to resettle here to the Department of State. That was November, December. In terms of the current situation, one really has to be honest and face the reality. This is something that is affecting the whole world, COVID-19. What have we done is, as a nation, we actually have stopped resettlement, allowing anybody to come in totally. In other words, we would rather deal with what we have nationwide right now and then open the doors later. At least that is what it is that has been passed on to us. And that's where we stand right now. And if you're talking about in terms of us kind of putting a halt to immigration, that does not directly affect us as refugee resettlement agency. So what affects us and where we've not been able to do much is the fact that since January, we really haven't had much of any arrivals. And as such, if we do not have arrivals, you find out that the resources the agency has kind of just dwindles. But already we have more than this 400 that we're working with here, and we're providing all those kind of services. Immigration per se, the United States Citizenship and Immigration Services is who we deal with directly when it comes to immigration services. They keep working, that office is still working, except that again, it's maintaining a social distance. So they're not calling in anybody for interviews, and we're not having citizenship ceremonies because that always involves a crowd kind of coming together. So probably when they reopen, sometime in June, if not later, I suppose everybody is kind of watching what's going to happen now. That is where we are.
Right. And then to also add some other context, over probably like the last 4 years, we've been seeing just a number of clients that we've received has declined every year. So while in January, the mandate from the federal government was to close the borders because of COVID, really those numbers that have been resettled into the United States has been decreasing for years now. And so we've really had to look at our programs and be strategic and think about where do we want to kind of reshift. If we're not getting a lot of people who are allowed into this country to be resettled, then as Ms. Yinka said, then what are some of those other programs that we're really strong in? And then how do we support the people that are here right now? And so we've had to add on some other programs and development in that area. And so 4 years ago, it was there were new policies about who could be resettled here. So we saw our clientele changing, and then it was, we're just going to decrease numbers and just keep cutting people off. And so it's interesting that, again, as of January, while the borders are closed, it's not like we were really, as a country, resettling that many people anyway. And so we're one of the few. Ms. Yinka, how many refugee resettlement organizations exist now? Then 2 in Pittsburgh had to close, right?
Yeah, 2
of us left.
So we only have 2 now.
Yeah, and so that was before COVID. That was as a result of the decrease in numbers coming to the United States because of policies at the federal level.
Absolutely.
So there were 4 organizations, now there are 2?
Yes.
Clarify.
Yes.
So very important, critical work that you're doing. One of the things that you did share a bit earlier is this intersection with, education, employment, and housing. So I wanted to hear a little bit more about some of the work around housing, particularly knowing, prior to COVID, displacement of families, lack of quality and affordable housing in our region. So, can you share a little bit about how that has affected the families that you work with, and has that been elevated even more now?
At the moment, I would not say it has been elevated. However, knowing that almost all of our clients are really impacted by the layoffs due to COVID, what that kind of brings up is the fact that everyone that has attained self-sufficiency, who are paying their rent, who are doing their job, taking care of their family, can no longer do that. What does that mean for their rent? We have taken time, and this is where there was extra job to be done during COVID time and staff spending more hours. We've contacted all our landlords one by one, both corporate and individuals, and we have advocated for each and every one of our clients, helping them to understand this client lost their job. What is your policy? What are you going to do under this circumstance? And basically what all of them have given us is the fact that they do understand we're all in this together. They're not going to charge any late fees to any client. Of course, they're not going to evict any client at this time, probably until maybe end of July, early July. However, they have also asked of us to understand that they need to pay their staff, they need to do maintenance, they need to continue to upgrade the place, and in places where utilities are included, they still have to pay those. With that in mind, they are expecting that all tenants will still pay their due rent. They also have indicated if tenants can bring in whatever they have now. Some asked for a certain percentage, like 50%. Others said whatever they have now, they can just bring, and then they can make a payment plan for the future. So those are the kind of arrangements that advocacy can bring about. And I know, yes, there are things that have been announced by the government, the Attorney General, and all that, but then you will find out that individuals can still decide to do their own things. All our landlords have been very gracious, and we've advocated, we've been able to pass on those messages to our clients to let them know that you don't live with the fear of eviction. What we've done on the other side is we've been looking for grants, explaining to our grantors and funders that this challenge of paying up rent exists. Is there any way we can do it without too much administrative bureaucracy going around it? We will make sure that all checks are issued to the landlord. We will make sure that we have a budget and we do the budget with the clients before we pay. So don't go saying, I'm only going to pay 50% because I know AJAPO is going to pay for me. Do your own due diligence. So it's been a lot of work, but I think it's very rewarding knowing that in the future, once our clients get back to work, we will be able to put their mind at rest and they can move on with the rest of their life and their families, you know, in another 3-4 months. But we're yet to kind of get there. So that's where we are as far as housing is concerned.
Right.
And I'm interested to see the city just is looking at some new legislation around housing discrimination, and they've brought up conversations around anti-immigrant rhetoric and immigrants who have been denied access to housing. And so, interestingly enough, this was happening before COVID. But I think that because of COVID and who is being discriminated against now, which is perceived to be Asians, that the city has now moved forward with looking at legislation around housing discrimination. So I'm interested to see how this commission continues to unfold, the Human Relations Commission, in terms of this policy, and then how that can then be a resource for our clients to tap into once they figured out what this looks like in practice.
Sure. Absolutely.
I suppose things are okay with them simply because, again, as I said, before they even arrive, we have landlords that we work with who understand that refugees will pay once they start working. We pay them their first 2 months rent and a security deposit, and they continue from there. We handhold them, helping them understand that, yes, housing is not free in America, you gotta pay. And that's one of the reasons, you know, kind of why you're working. So if they stay in those homes longer, yeah, they'll be fine. If, however, they decide to move elsewhere, which they have a right to do, I think that is when they face the discriminatory kind of issue. issues and challenges, because landlords, they hear the language alone, they find out they have an accent, and that's the end of it. I don't know who this person is. How am I sure they will ever pay?
Your work is vital. Can you please share with ways in which others in the community can support AJAPO's mission and ongoing work?
I think volunteering is one big part of it. We've had students who come in and just kind of voluntarily place internship on themselves and say, oh, can I help with immigration work? Can I help with this? Can I help with that? Yes, many people actually always think they will come and volunteer, and they will think of meeting with the immigrants themselves, but many of them are at work. However, the background work that we do for them, which still impacts them, whether it's in immigration or administrative work, or whether it's in taking them to job places where they get employed, or whether it's giving them support on how to ride on the bus to be able to get to the hospital, or whether it's talking to a teacher at school about the issues that a kid have. All these are all good support that others can give to our agency to be able to help the refugees kind of stand here. Of course, there's always the teaching of the English language, which if people can do on a one-on-one basis, it's more effective. And we do have another agency that can train anyone who wants to teach English language. It's free. They will be taught on the methodology and how to kind of get across, and they will be able to start providing such services.
I'll also add that once you all who are listening visit our website, you can donate directly to AJAPO. So when a lot of our conversation has centered around policy and some of the big picture when it comes to resettling immigrants and refugees, but the day-to-day work that our staff do is so critical. And so those donations help us. So imagine you have someone coming to the United States with just the clothes on their back. They need kitchenware for their kitchen. They need bedding for their children's rooms. They need medication. They need just some of those things that we have that we might take for granted. People who come here don't have those things, and or you live here, but then how to access those resources, especially now with transportation being limited. Port Authority has decreased busing routes and no more than 10 people allowed on the bus, or the bus will just keep going. And so in times like this where it's really hard, yes, we know there's resources that the county offers, but as an agency, it's so vital to us to be able to provide those resources ourselves for our clients when they need them. We know them, we've built those relationships ourselves. So any donations that people can graciously give us helps us to be able to address those immediate needs of our clients. And so again, you can either access that on our website, and we're also a part of United Way. So we have one of those codes. So think about us when you're wondering what organizations that you can believe in and that you know we're doing great work and support.
Thank you for that. And to learn more about AJAPO, as Ms. Davis mentioned, go to ajapopittsburgh.org. You can also visit the website to donate. And thank you both for joining me.
Thank you so much.